how do we get to a point where we are talking about, it being not such a burden financially? Is it ever going to get there? Because for something that's been around for so long, I mean, malaria has been around so long, people seem to find a way to, I get certain pills and I'm able to. HIV and AIDS medication has been subsidized. Yes. Why is cancer still up there?
Well, the major issue we have with cancer is, like I said, the funding for the research, for cancer research, is massive. So the amount of money that goes into developing new products to treat cancer is super expensive, and the pharmaceutical companies have to recover their money somehow. So that is where we have private donors and also governmental institutions to help subsidize some of these medications and some of these treatments. Some of them are already ongoing at the moment. Some drugs are gotten at a subsidized fee. Some treatment modalities are also gotten at a subsidized fee. So all we have to do is just to amp our efforts there until it gets to a point where some of those drugs are even cheaper, because, like I said, the pharmaceutical companies have recouped a lot of money that they spent in the research in the first place.
I'm not a conspiracy theorist, so I don't want to get into the pharmaceuticals and all of that. But I mean, because for a lot of people, it's like HIV/AIDS came, it became a big deal. A few years down the line, it's cheaper.
Yes,
to
definitely.
live with it. Yeah. With cancer, it's weird how it literally wrecks people's homes financially, and you almost can't get a headway out of it. Where are we with regards to treatments, cancer centers in Nigeria, and all of that? Are you comfortable with where we are in Nigeria with regards to being able to help people who are diagnosed with this?
Comfortable, yes and no. I say yes because we have brilliant oncologists in Nigeria at the moment. We have cutting-edge technology in some centers. But then no, because we have 200 million people in Nigeria. And then how many centers are there? How many oncologists are there? How much data do we have about cancer? We can't influence policy much. We can't create policies through the law and by government to influence maybe helping outcome of cancer patients if we don't have data to back up what we are coming with. So there's a lot left to be done.
There's a lot left to be done.
Exactly. And especially also in terms of, like you said earlier, funding. A lot of people are dying, not just because the chemotherapy regimen is there ready for them, but the sheer money they have to spend in a country where the minimum wage is about 33,000 naira. And you have one drug, some medications, one vial is going into the hundreds of thousands. That is a year's salary for some of them. So these are the challenges that we face. And also early detection is a challenge, because we'll find a majority of our people I will use the quote, testing it, or like enduring it until it gets pretty bad before they present, because they are afraid of spending money at first. And then the money they are afraid of spending, they are spending way much more than that in the end. So these are some of the issues that we have here in Nigeria.
What are some of the biggest cancers we have here in Nigeria?
Okay, for the females, we have breast cancer. Breast cancer and cervical cancer are the major, those make up the bulk for the females. And then for the males, we have prostate cancer and colorectal cancer. Worthy of mention, by the way, is the liver cancer and the lung cancers as well. And I'm mentioning liver cancer because there's something we can immediately do about... Which is, first off, reducing the intake of what we call abo over here, traditional herbal medication. But some of them are pretty bad because, some of our people, we don't even look at NAFDAC numbers or registrations or anything. And some of them have very liver toxic materials inside them. We have had several cases like that where this cancer would never have happened if this person's liver was not so much damaged by some alcohol, especially alcohol-based herbal concoctions and all that. But aside that, of course, that's not the only thing that can lead to liver cancer. There's the hepatitis B and C as well. Brilliant thing is that we have hepatitis B vaccination as well. So some of these are practicals that you can, by yourself, sit down and eliminate the cancers you could possibly have in your life. You can actually do that for yourself. You can just say, I'm going to get the hepatitis B vaccination. I'm going to get the HPV, like I said earlier, for cervical cancer. I know that there is almost no chance of these things happening later on to you with the proper lifestyle habits. So,
So basically, stop drinking Agbo.